Hello everyone, welcome to Pediatrics by Dr. Anand. The beautiful segment, beautiful life, beautiful day, and a beautiful why? Because amazingly we get to study together. This is one of the most beautiful platform on this planet, Academy platform. My name is Dr. Anand, and I hope my voice is audible to everyone. Please put a message in the comment section if my voice is audible to everyone. आवाज आ रही है या नहीं आ रही? Please raise your hands, yes or yes. Then only we can move further. My name is Dr. Anand, assistant professor in a medical college, and मेरा mobile. Yes, is my voice? Yes, it is coming to me. Is it coming to you? That's the question. Okay. Good evening, Dr. Osama. Unacademy helps us to join together, to be together, to connect together. Nice, no? Join together, be together, and connect together. It can be a nice tagline to a nice advertisement. Also, at the same time, this is a very beautiful platform. Why? Why? Where is my pencil? Pencil kind. Eventually. Yes. So yes, the best part about Unacademy, most importantly, yes, get a 3 months extension on your 6 month plus subscription that is valid from June 13 to June. Also, at the same time, get a 6 months extension on your plus subscription of 1 year and above. Again, valid for June 13 and June 15. Subscribe now, you get amazing, beautiful off. And this is the number where you can contact for any kind of queries. Also, at the same time, in Unacademy, our target is to 2023 batch, 6 months module and a 3 module, subject wise revision batch and a high yield revision batch, and also beautifully amazing people and faculties we have help us out. Also, at the same time, NEET 2023, we have a discussion batch for the previous students. 9 months, duration. June 2022, it is starting, and faculties are in the Unacademy, as we all know. Second, in the Unacademy, as we all know, one second, yeah, we have the plus subscription, iconic subscription, light subscription, and MBBS subscription, and UPSC subscription for beautiful, amazing students. These are the prices and duration, as every one of us must understand this. Today's topic of choice, yes, is my voice coming? बहुत सारे लोग आए हैं. Dr. Aryan, okay, your Dr. Aryan's ID is something new. Sounds good. Okay, good evening, Surgery Dr. Shubham. His ID is Benedict's. Okay, Kavya, Rajendra, so many people. What's up, bro? How are you doing? This is Dola Ka Dola. Yes. Today was Aj. So how was your evening, everyone? How was your evening? What all you guys did? Please let me know. क्या किया? पढ़ाई किया? बस time waste किया? क्या किया? What did you everyone does? Can we please have an answer in the comment section? How many of you are serious about your life? Could you please tell me? How many of you played badminton? How many of you went for running, jogging, skipping, skating, piano classes, guitar classes, and Dr. John says I did time waste. Ooh, okay, that's Dr. Sahil says I studied microbiology. That's perfect, beautiful. Oh, Aryan says party plans. I love party plans. But how come party plans, Aryan? अभी तो हफ्ता end भी नहीं हुआ है. The weekend has not come right now. How can you have party plans so early? I'm jealous of you. Osama, आज इवनिंग अच्छी नहीं गई. टेस्ट ड्यू टू टेस्ट. कौन सा टेस्ट? पीडियाट्रिक्स बाय डॉक्टर आनंद. जहाँ तुम्हारी खिंचाई हुई वो वाला टेस्ट की बात कर रहे हो क्या? और तुम्हारे कोट बहुत अच्छे होते हैं ओसामा. ओके, शुभम कह रहा है इट वाज स्टक. इज माय वॉइस कमिंग? आई होप द वीडियो इज परफेक्टली फाइन. ओके, यस, आई होप इज माय वॉइस इज कमिंग टू एवरीवन. Great. Okay. कोई बात नहीं, सब अच्छा होगा. Everything will make sense. Today's topic of choice we have is nothing but retinopathy of prematurity. Retinopathy of prematurity. Very importantly. And yes, let's start this amazing segment actually. Yes. Retinopathy of prematurity. Let's talk about it and then we'll have a motivating quote in between. Actually, सारी motivating quotes खत्म ही हो चुकी हैं. Like I have the whole Google, I have Chartofy and there's nothing left. Like I have to search for. It takes time. It takes, if it takes 10 minutes to prepare a lecture, it takes me 20 minutes to prepare a motivating quote. Motivating quote में ज़्यादा time लगता है मेरे को. Something which clicks to the heart, something that's like, oh my god, like wow factor you have, like the way we have in Dr. Osama's quote, right? Yeah. Dr. Jones says search for demotivating quotes. Please. Hello, relax. Dr. Monimala says tomorrow is my birthday. Okay, happy birthday in advance, Dr. Monimala. Can we please say happy birthday to Dr. Monimala? We all are like one family, and it's our duty to help and to motivate each other. Today's topic of choice is two. Exactly, yeah. Monimala says, "Kal batana, abhi yaad rakho." Cute, very nice. Yeah. Dr. Suman says, "You are the example of motivation." Yes, thank you so much. And acha, I didn't tell you, I had a great time today evening. Actually, before I was doing what you called, मेरा drop चल रहा था gym में. In the gym, my drop set was going on. Today, I started superset. Like this is one of the very heavy exercise in gym known as superset, where we do two exercise combined in one, and I alone do it. My instructor helps me very nicely because no one actually is able to, in the whole gym, no one is able to compare to my weight, and I'm like so happy. My gym instructor is very happy. He's like, you are a good icon and good example in this gym. You don't stop coming to gym and keep working hard. Thank you, sir. Question number one. The today's topic of choice is nothing but retinopathy of prematurity. PG entrance question number one. Hanji, please can we talk about studies now, buddy? Exactly. Yes. Hanji, what is the other name of retinopathy of prematurity? If I am a new student to Dr. Anand classes, my friend told Dr. Anand is good and all, you should attend classes. Today is my first class. So could you please tell me a retinopathy of prematurity? What is the meaning of this strange word? So can I appreciate this point that premature babies are more prone for some eye problem, some retina problem, some retina, some eye issues? Can I understand this point like a vague, like a rough term? The more the baby is premature, the more the baby can have retinal vessels damage. Nothing but retinopathy. Why, sir? Why a premature baby will have more issues? Naturally, the cutest answer on this planet is that the retina vessels are very immature. The retinal vessels are very fragile. So can I say very, very important that these are more prone for hematoma, these are more prone for injury and more prone for damage, right? This is the one thing I understand. Dr. Suman has a very beautiful answer. I asked what is the other name, or what is the other name, what is the syndrome we call it as in a name of ROP? Yes, it is also known as Terry syndrome. Very, very, very important point. It is known as Terry syndrome, or also known as retrolental fibroplasia. Okay, very important question. Okay, the question, there was a recent FMG question. A baby is suffering from Terry syndrome. Then the whole full length of the question started, and everyone just left the question. Terry syndrome, I've never heard. Only what will I answer? So now you must understand that the other name of retinopathy of prematurity is nothing but Terry syndrome only. Okay, also known as retrolental fibroplasia. Right? This is the first. Second point we need to understand, like this topic will be subdivided into causes, why the baby will have retinopathy, when should I screen such babies. Let's think about it. Let's think. Yes, the cause of the retinopathy of prematurity is already over. Like number one, it is multifactorial. Very, very, see again, okay, hello, have a concept, just relax. My classes, just chill. Just think, relax your brains. Retinopathy of prematurity, a premature baby will have definitely retina issues due to multi-factor. One factor we all understand, the more the baby is premature, the more the baby's retina vessels are fragile and immature and all that. That we all know that already. But it is a multifactorial. It is a multifactorial, problem. Why multifactorial? One, though I understood that prematurity is one of the important causes. The second important cause, very importantly, can I say oxygen toxicity? Oxygen toxicity. Why, sir? Why? What are you trying to say in oxygen toxicity? Can anyone answer me? Exactly. You never see what is the target SpO2 of a newborn? Very nice question. What is the target SpO2 of a newborn? Who will tell me? Anyone? Target SpO2 of a newborn. If a preterm baby is there, okay, the example is that can I put 99% oxygen? A newborn baby SpO2 right now it is 94%. So what to do? Any baby having SpO2 94%, is this fine? What is your normal SpO2? So your and mine SpO2 is 96 to 98%, right? but a newborn baby. Dr. Suman, 85 to 90 is very less, frankly speaking. That the take home message is roughly 92 to 94. Okay, I don't want to confuse you by saying for preterm this is the target, for term baby this is the target. Roughly in a very light and happy zone, 92 to 94% is the target saturation of a preterm or a term baby. You never want the saturation target of a baby more than 94%. I have just opened a new hospital. I have a free oxygen cylinder. One baby having 94 saturation, it's okay. I have extra oxygen cylinder. Okay, let me give the baby 99% of target SPO. So do you want to do that? No. Why? Because this oxygen itself is very, very toxic to the baby. Because once you give oxygen, no, naturally oxygen will do what? There will be neovascularization. Neovascularization. What is this meaning of neo? Neo means new. Vascularization means formation of blood vessels, right? So once you give oxygen or help the baby will have new formation of blood vessels. But what about this? But what about the status of this new blood vessels? They will be very fragile. Same thing. They will be very sensitive for the trauma, and the baby will end up into nothing but more retina damage. So you're doing नुकसान ज़्यादा कर रहे हो, फायदा कम कर रहे हो. That's the whole thing. Yes, exactly. Neovascularization. That is the take home message. So this part is over. That I can understand now that retinopathy of prematurity, it is a multifactorial retinal disorder that increases in incidence with decrease in gestational age. Yes or no? The more the gestational age decreases, normal pregnancy is 37 to 41 completed weeks. The baby is 36 weeker, 35 weeker, 32 weeker, 30 weeker. The more the gestational age increases, like decreases, the more chances are there naturally the baby will have more retina damage, and this is a very beautiful picture, guys. This is a very beautiful picture. This is a very important example. Okay, so this is a very important picture. They will ask you in question, look at the image shown in the picture and tell me that the doctor on duty is doing what. So the doctor of duty, what is it doctor of duty is doing exactly? Yes, it is doing, yeah, the doctor of duty क्या कर रहे हैं यहाँ पे? He is doing ROP screening. Can I write ROP screening? Very, very important. In the further slides, I'm going to ask you this question basically that I'm going to ask you this question that what do you call it? Is this indirect ophthalmic examination? Is this known as slit lamp examination? I'm going to ask you in the further slides. पहले तो ये तो messages पढ़ो. Okay, doctor, what do you called? मैसेज भी तो 25 तो मैसेज आते हैं भैया. किस किस को ब्लॉक करें और किस किस को हाँ करें और किस किस को क्या. तो ये ओके सो पहले तो मुझे मैसेज पढ़ लो. डॉक्टर प्रतीक इज सेइंग आपके लिप पे क्या हुआ है ये. ओके देन कौन बोला ये आगे. ये डॉक्टर सुमन सेज दैट्स अ मोल प्रतीक. ओके आगे मैं क्या ही खत्म कहानी हो गया इतना. Okay, so yes, exactly. Why will I block you, Monimala? I will not block you. Let's finish this point. So as the baby will have more insult, so more the baby is premature, I assume the baby will have more insult. More insult means more hypoxia, and more hypoxia means decreased blood flow to the developing retina. There will be decreased blood flow to the developing retina. So I will not, confuse you. Just you already know the basic answer that the more the baby is premature, the more the baby will have the retinal vessels are very fragile and they will lead to trauma and hemorrhage. That's it. Okay. Now this, I have a question. Which infant should I screen and when to screen? Very nice question. Can anyone please answer in the comment section? Yeah. Who will, anyone, any random guesses? Yes. कौन से बच्चों को स्क्रीन करना है, कोई कोई बता सकता है करके. Yes, very good, very good. Okay, so yeah, so which baby to screen? Do we have any what do you called? Yeah, do we have any specific weight specifications? Anyone? Yeah, that's a very good, beautiful answer. Yeah, so the answer is weight less than 1.5 and week less than 32. Very, very important, guys. This is what the exam question. I don't want you to have the whole PhD on the ROP topic, but at least I want you to know, number one, that the baby, it is a problem of a premature baby having retinal issues, right? Number one. Number two, weight less than 1.5 kg and week less than 32. Dr. Shubham, I have a doubt with you, bro, that intraventricular hemorrhage. Can we please correlate and study which babies for screen for IVH? When and which babies are screened for intraventricular hemorrhage? Can anyone answer in the comment section? Anyone? Dr. Kavya says ELBW. Okay, exactly. Weight less than 1.5 was the same, and week less than kitna tha? Anyone? Week less than anyone? Anyone? Dr. Suman, I'm asking something, dear. I'm asking. Yeah, yeah. Week less than kitna tha? Anyone? Osama, you sure week less than 32 था? मेरे को तो ये नहीं लगता. Anyone? Yesterday only studied, right? Week less than 34, weight less than 1.5. Okay, thus the ideal babies who are normally screened are weight less than 30, weight less than 1.5, week less than 34. Remember I told you that 34 to 37 weaker baby is a late preterm, right? So late preterm in general you don't screen for IVH if they have a bad neonatal outcome. The baby was in shock and inotropes and this and that, then definitely you screen. Otherwise weak, yes, otherwise weak less than 34, weight less than 1.5, and ROP same weight less than 1.5 but weak less than 32. Next question. Hanji, yeah. And of course, when to screen. Now, this is already someone has answered this question. When to screen? The best answer for now, this is another exam question. Obviously, this isn't the only exam question. When to screen for the babies of retinopathy of prematurity? So, 4 weeks postnatal age or at 32 weeks of what you call 32 weeks period of gestation or 4 weeks postnatal age. This is really very important. Are you understanding? Please put a like button. Ye important hai, bro. I'll repeat again. At 32 weeks of period of gestation, I will screen for ROP or 4 weeks postnatal age. 4 weeks postnatal age. Very, very important. Whichever is later. Whichever is later. Again, now I have 5 more questions to ask you. Now, quickly, please put your brain inside this topic. If the baby, yeah, so if the baby is, for example, if the baby is 28 weeks old, a 28 weeks baby has born, I am the pediatrician on call. Could you please tell me when should I screen this baby for ROP? When should I call the pediatric ophthalmologist for the ROP screening? Who will tell me what is the best answer? Yes, so 4 weeks postnatal age means postnatal age, right? Postnatal, the baby born is 20, कहाँ चला गया? The baby born is, यहाँ लिख देता हूँ, the baby born is 28 weeker, right? So 29, 30, 31, 32. So 32 weeks is the best answer where I should screen this baby. Okay. Now I have a question. I have a baby who is 27 week. A 27 weeks baby has born. Now अब कब screen करना है? When should I screen this baby? Anyone? This is a very important question, guys. This is the important question. A 27 weeker baby has born. I am planning for a ROP screening. If I say 4 weeks postnatal age, it becomes 28, 29, 30, 31. So is 31 the right answer? Can anyone please tell me? तो इस हिसाब से तो 31 बना ना. Is 31 the right answer? Yes or no? Or you want to add something? Anyone please? Yeah. So very beautiful answer, Dr. Suman. No, the answer will still remain 32 weeks only. Remember, 4 weeks postnatal age or at 32 weeks period of gestation, we do the ROP, whichever is later. Whichever is later. ये later का मतलब यही है. Okay, if the baby is 27 weeker baby, normally 28, 29, 30, 31. So 31 weeks I should scan, right? But no, whichever is later. So what is later? 32 is later, right? At 32 weeks period of gestation, that is later. No, so that's what. Okay, if the baby is 26 weeker, quick answer, a 26 week baby has born, when should I screen him for ROP? Very quick answer. If the 26 week baby has born, 4 weeks postnatal age becomes 27, 28, 29, 30. it becomes 30. But do you screen at 30? No. Same, the answer becomes at 32 weeks of period of gestation only I will screen this baby. Why? Because the book says whichever is later, whichever is later. So are you understanding, bro? The baby is 27 weeker, 26 weeker, 25 weeker, 24 weeker, 23 weeker, 22 weeker. When are you screening those babies for ROP? The best of the best of the best answer is 32, 32, 32, 32, 32, because it says whichever is later. Has everyone understood this much? Please put a heart button in the comments so that I can continue further asking you some strange questions and आंसर नहीं करोगे. हाँ जी, सर मैं आगे बढ़ूँ मैं, या फिर इधर ही झटके खाएं लाइफ में? ओके, परफेक्ट. चलो ठीक है. Did you get it, bro? So 28 weeker, 27 weeker, 26, 25, 24 weeker, all those babies I must do at 32 weeks of life, because according to me whichever is later wala is 32, right? But I have a question here. If the baby is 29 weeker, if the baby is 29 weeks old, newborn baby has born, now when should I screen him for ROP? So again, 29 weeks baby has born, no? So 30, 31, 32, 33. The answer becomes 33 weeks, right? And what the book was saying, at 32 weeks of gestation, we should ideally scan the babies, or 4 weeks postnatal age, whichever is later, right? So इसमें later क्या है? In this condition, what is later? 33 weeks. Are you understanding? If the baby is 30 weeks who has born, I am planning for ROP. When should I screen? The baby is 30 weeks born, right? So 31, 32, 33, 34. So the answer will be 34, because this is later, later, later. I hope everyone, if you have still not understood, I would recommend you to have 10 almonds per day. 10 बादाम खाएं, सरसों के तेल की सर मालिश करें, मम्मी को बोलें कि चंपी करें, आपकी आँख बढ़ेगा उससे. ठीक है. That is over. Yeah. Okay. Onimala says killer. Great. ठीक है. अच्छा चलो आगे बढ़ते हैं. What? Okay, see, it's a light topic. Let's talk about it. Okay, life is such a beautiful journey, such a beautiful thing. We are so fortunate. We are living and talking and just living life, right? So, can you just talk to me and tell me, bro, risk factors for ROP? What are the various? At least, can you tell me what risk factors which we have discussed? Number one, very very important risk factor is prematurity. Can I say prematurity is a risk factor? क्या ROP हो सकता है? Naturally. Can I say oxygen toxicity? Naturally, is a kind of a risk factor. Don't give 100% oxygen to a newborn. Oxygen can cause, it's a toxic drug. Like it can cause toxicity basically to the baby, right? Exactly. हाँ. क्या हुआ? मनीष क्या कह रहा है? ओसामा भाई क्या कह रहा है? ओसामा कुछ कह रहा है क्या? ठीक है. So oxygen toxicity is the right answer. And very importantly, the other important points are these all. The other risk factors are, other than prematurity, oxygen toxicity, we got it. If the baby is in shock, then also it can damage the retina of the vessels. See, what is the whole thought process? Like, what is the thought process I should stick in my mind? You should stick in your mind is hypoxia. You should stick something in your mind is there is some insult to the baby. Remember, my dear, please remember, whenever there will be some insult to the baby, then everything will be compromised, right? The blood flow and all that, and then retina blood flow will be compromised and all that, and that's what you should. The shock is like an insult to the baby. Sepsis naturally is like a hypoxic insult to the baby. Hypoxia itself, if I give lot of blood transfusion, that also judicious use of blood transfusion. Blood transfusion also can cause intraventricular hemorrhage, too much of bleeding and all that, and even patent ductus arteriosus, right? PD also, like and like again, in a simple word, congenital heart. If I have a congenital heart disease, naturally my heart has to pump more blood, right? It's like giving more work to my body. It's like insulting my body, and whenever there is some insult, there will be change in the blood vessels transitions, and retina will be damaged, leading to retinopathy of prematurity. ठीक है, चलो आगे बढ़ते हैं. This is a good one. Okay, हाँ जी, आगे आ जाओ. It's a very happy, what you called topic. So where to examine the baby? Like I am there is one preterm baby has born, and I called the pediatric ophthalmologist basically to come and please screen for ROP. बच्चे का आंखें check कर लो एक बार. And there was a recent medical legal case also. I remember like the baby, like in the what do you call, in some hospital, I remember that a newborn baby was missed, the ROP screening. The ROP screening was missed in that premature baby. Once the baby became big, after few years of life, the baby became blind. The baby was blind, and the parents did a medical legal case against the hospital and the doctor. So they had to pay 50 lakhs rupees. The whole hospital paid 50 lakhs rupees basically to the whole what you called parents and family for the blindness of the baby after like some 10 years, after many years. So that's why in our hospital everyone is extremely scared for ROP screening. If in your hospital also, if you don't have the facility for the ROP also, you write in your notes, okay, ROP screening advised, okay, ROP screening not available, ROP screening advised, like that you must, tell to the, ठीक है, exactly. तो बातें हो रही हैं, बातें क्या हो रही है? क्या है मेरे, अच्छा, मेरा से लोग कह रही है कल देना पार्टी, मोनी कह रही है रात 12 बजे के बाद, ठीक है, डार्क रूम ओके, एडवांस ऑर्डर करना होगा ना, ठीक, हाँ, बातें 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 करा लो, बातें, ठीक है. अच्छा, हाँ, when where to examine the baby, the best answer is NICU. Can I write NICU NICU में I call the pediatric ophthalmologist to my ICU, okay, newborn baby वाला neonatal intensive care unit. Next question. Yeah, do you remember I always tell I always ask you this question, is it difficult to constrict a baby's pupil, or it is difficult to dilate a baby's pupil? Can you please answer in the comment section? Yes, please. Okay. Dr. Ajay says, love you, sir. Thank you, bro. So much of love from my side also. Thank you so much. That's very kind of you. Okay. अच्छा, वो क्या कह रहा है? मनीष कह रहा है ऊपर पढ़ो, ऊपर. ऊपर पहले. हाँ, ठीक है, ठीक है. हाँ जी. I remember it is very difficult to dilate a baby's pupil. Why it is so difficult to dilate a baby's pupil? As everyone knows, the baby has immature iris dilator muscle. The baby has immature iris dilator muscle. Okay, remember that. Okay, and how to dilate? Everyone has beautifully told. हमारे पास ट्रोपैक आती हैं ड्रॉप्स. We have Tropac drops in our hospital known as Tropicamide, और Tropac P करके भी आता है. Tropac P is nothing but, very importantly, it has a phenylphrin or proparacaine also. Helps in dilating the drops. Exactly. Hanji. Perfect. Next question, please. Yeah. And very importantly, pre-anesthetic preparation. Naturally, take the consent of the family that we're going to examine the baby's eye. I'm going to call the pediatric ophthalmologist. As your baby is a premature baby, you can have some eye problem and all. Right, and make sure before the ophthalmologist comes, like you're gonna waste the ophthalmologist time. We always fight also sometimes with the ophthalmologist. What is this, Dr. Anand? You have not dilated the baby's pupil, and we have come from OPD 100 पेशेंट छोड़ के हम आपके बेबी को देखने के लिए आए, और आपने बेबी का प्यूपिल डायलेट नहीं कर रखा. एंड आई एम लाइक, मैंने अपने सर को कहा था, मैंने अपने जीआर को कहा था, मैंने अपने इंटर्न को कहा था, बेबी का प्यूपिल डायलेट नहीं हुआ. व्हाई? बिकॉज इट इज डिफिकल्ट टू डायलेट अ बेबीज प्यूपिल, राइट? दैट्स व्हाई their dilator muscle is like immature. It will be constricted only, but I have to dilate a baby's. Remember that. Okay, perfect. Okay, okay, yeah. Okay, now this is a good one. What does the examination entail? Good question. Like if the pediatric ophthalmologist has come, does he need anything? Should I make something ready before he comes? Can anyone answer in the comment section? Metasilosis is hyperglycemia a risk factor? Very less likely. Very less likely, dear. Very less likely. ठीक है. अच्छा, पूरी बातें, बर्थडे हो रहा है, अच्छा, ओहो, आज प्री बर्थडे, कल बर्थडे, बातें क्या, बारात चल रही है, एक घंटा घर है यहाँ पे, लोग बातें करने आते हैं. पढ़ाई हो रही, पढ़ाई पढ़ाई हो रही, पढ़ाई. गाने भी गा रहे हैं. हंसते हंस कट जाए रस, जिंदगी यूं ही चलती रहे, मिले या आगे क्या है, हाँ, एग्जैक्टली. तो एग्जैक्टली, वेरी इंपॉर्टेंटली, द ऑप्थेल्मोलॉजिस्ट नीड अ indirect ophthalmoscope. Again, a very can we appreciate this picture? Please remember, there is something known as direct ophthalmoscope and there is something known as indirect ophthalmoscope. We're using 20 diopters lens. So this is a very beautiful picture, bro. They can ask you in exam that identify the image shown in the picture and explain what is the procedure has been done. So the best beautiful answer for this question is indirect ophthalmoscope. How do you do direct ophthalmoscope, anyone? Can anyone answer in the call? Can we have a clinical knowledge, please? Can we share some good clinical knowledge? How do you do direct ophthalmoscopic examination? Anyone can answer in the comment section. Quick answer. तो डायरेक्ट ऑप्थेल्मोस्कोप मतलब वो होता है वो पकड़ के ऐसे ऐसे जो तुम्हारे नजदीक आ जाते हैं करके द वन इट कम्स वेरी क्लोज टू यू रिमेंबर दैट थिंग ophthalmoscope and they the eye and they come so close to you, that one is direct ophthalmoscope. This one is the indirect ophthalmoscope. Exactly. Okay, remember that. Perfect. Very good. Very good. Okay, perfect. Next question. Yeah. What is the instrument shown in the picture? Can anyone answer in the comment section? It could be another instrument class now. What is the instrument shown in the picture? What do you call it? What is this? What do you call it? Anyone? Anyone? Any random guesses? Yes. This is nothing but very important. Alfonso eyelid speculum. This is Alfonso eyelid speculum. Alfonso कहाँ पढ़ा था और where have you read Alfonso? Yes, you can say wire speculum also, lid retractor also, but hi-fi word is Alfonso eyelid speculum. Alfonso वाले आम भी आते हैं, ठीक है? Yeah, and how to record this finding? Whatever that retina damage, and there are some 5 zones. It is pre plus plus and many things are there that ophthalmologists will tell you, but we record the filing in this one. This can we appreciate it's a ROP screening form, and basically how much this is the right eye, this is the left eye, this is the date, fundus, examination, all the patient details are there, and how much is include how much damage to the retina is there. So zone 1, zone 2, zone 3, like that you have to mention, and that's it. Okay, exactly. Alfonso. Okay, so Alfonso is at two places. Okay, Alfonso eyelid speculum is over here. Okay, remember that. Okay, what precautions to take during examination? Should I take any precaution to take examination? Exactly, yes. So the precaution naturally that only to keep the baby's vitals in monitor. Okay, keep the baby vitals RBS in monitor. And how can you avoid discomfort to the baby? Anyone? How should I avoid discomfort to a baby? Should I sedate a baby? Yes or no? Should I sedate a baby? Will it be beneficial to sedate a baby? Or you guys have any, or you are like PhD holders and you have some amazing thing to tell me? Hanji, anyone? Yes. How can you avoid discomfort to the baby? The best answer for this question will be sedation is okay, leave the sedation, but the best answer is giving oral dextrose. Right, today evening we had a test, right, and Dr. Vikas got the first prize. So there was a question, right? You can like it's like an analgesia, like an anti-pain medication is nothing but dextrose. You can give like cotton में dextrose को dip करके ना baby को हल्का सा आप वो suck करने कर सकते हैं, and that's what. Okay, yes, exactly. So you don't, yeah, exactly, Priya is right, don't give any sedation, oral dextrose is fair enough, and of course a little swaddling the baby. Okay, perfect. Next question. Yeah, what is the treatment? Anyone? What is the treatment of this condition? What is the treatment for this condition? So there are three important conditions. See what are we doing in the this one treatment? See, there are abnormal vessels, right? There are abnormal vessels, number one, right? I told you neovascularization, right? Number one is the baby is premature, retinal vessels are very fragile and they are more prone for trauma and hemorrhage and edema. And also the whatever the new blood vessels have formed, they are very fragile. So what is my this what is my aim of this treatment? My aim will be thermal destruction, thermal destruction of the abnormal. Yes or no? Do you agree with this? The abnormal vessels, the immature vessels, the fragile vessels, basically I would like to do thermal destruction. And this thermal destruction, I have two options. Either I can give laser coagulation or I can give cryotherapy. Okay, are you that take home message is important. Okay, like what are we doing? That abnormal vessel which has formed, which is damaging the retina and not helping the baby, I'm gonna discard them, destruct them, and like close them. And the closing options are laser photocoagulation and cryotherapy. In the cryotherapy, basically I freeze basically the tissue, whatever that abnormal vessels or tissue is there, I freeze them. So cryotherapy, that is cryo. And then we have is laser photocoagulation. So by laser therapy, I can destruct those extra vessels, and by cryo means by freezing them, I can destruct or stop that thermal that vessels. That's it. So the take home message is laser therapy, cryotherapy. One very important. And yes, very important question. We have a anti-VEGF therapy. What is VEGF? So yeah, vascular endothelial growth factor. Actually, there's a proliferation of VEGF, vascular endothelial growth factors, basically, which helps in which is making the retinal vessels, but those retinal vessels are immature, right? So I'm giving anti-VEGF therapy. I'm giving anti-VEGF therapy because if there is a VEGF, vascular endothelial growth factors are generated, they will cause the neovascularization, but that will cause more damage. Anti-VEGF therapy is the treatment of choice in a case of what you called ROP. And what's the treatment of that? Yes, the treatment is bevakizumab. Bevakizumab. Very importantly, bevakizumab. And where did you read Ivacaftor? Ivacaftor कहाँ पे पढ़ा था anyone? If bevakizumab is there in the ROP treatment, where have you read Ivacaftor? Yeah, anyone? Ivacaftor? Yeah, very good. So Ivacaftor, basically it is there in a case of cystic fibrosis. Yes, in a case of cystic fibrosis, Ivacaftor is there at as low. So basically, anti-VEGF therapy, vascular endothelial growth factors, basically helps in the neovascularization, which we don't want. Because neovascularization, the new blood vessels are very fragile and they can lead to damage of the retina. So anti-VEGF therapy sounds a very good option. The treatment of the drug of the choice is bevakizumab. Very, very important question I have is, yes, how to give bevakizumab? The options are subcutaneous, intravenous, or intramuscular. Quick answer. Can we have a very quick answer for this one, please? Hanji, how do you give bevakizumab? Very good. Very beautiful answer. Perfect. Amazingly, students are giving this beautiful answer. How do you give bevakizumab? Very beautiful. Our Sahil says intramuscular. Kavya says intramuscular. Okay, very good. So beautiful. Metazillo says intramuscular. Very good. Okay, very beautiful. Ritu also intramuscular. So such a beautiful have. इतने बढ़िया लोग हैं, मजा आता है सुनकर. सवाल जवाब बहुत सुंदर. Yes. So the answer, the best answer for this question is nothing but it is given intravitreal. Intravitreal is the drug. You know vitreous humor, right? It is given in, I have seen, I went to Chacha Nehru Bal Chikitsa Hospital and many straw eye hospital, like our hospital, like once we refer the patients for ROP screening, like for serious patients, I myself had gone and they had literally intravitreal, and it's so intravitreal sounds a very important, yeah. Not subcutaneous, not intravenous, not intramuscular. It is given intravitreal. यहाँ लिखा है, ये देखो लिखा है यहाँ पे. अंधा भी देख ले यहाँ पे. Intravitreal is a ent. So very. Can we read this line? Anti-VEGF is given intravitreal. Dr. Shubham. Dr. Shubham, I have a question, brother, for you. What is this? This one. Is this a ampule or is this a vial? Anji, कौन बताएगा? Dr. Shubham, quick answer, please. Is this an ampule or is this a vial? Suman, Osama, Nisha, Priya, Manish, Moni, Mala, Suman, and beautiful people. More students. Very good. Very good. Okay, okay, exactly. Perfect. Okay, remember, yeah. This is nothing but a vial. This is a vial, guys. Remember, please. Ampule looks like this, okay? वो जो ADR का आता ना ऐसा. This one. Okay, yeah. This one is ampule. Okay, it's like a A. Did you understand? Please put a like button. Have you understood? Many of us do this mistake. Okay, so this is nothing but an ampule. This is nothing but a vial. This is nothing but a vial. Okay, remember that. हाँ. Oh. दूध की बॉटल बनाई है सुमन ने. ठीक खत्म हो गया. And that's what the mechanism is. It will cause the blood vessel reduction. Blood vessel reduction it will cause. Anti-VEGF therapy, and it's given intravascular, intravitreal, and to prevent the बड़ा बड़ा लिखा हुआ है यहाँ पे, to prevent the neovascularization. Okay, done, 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 done. This part is over. Yes, the first half of the topic is over. Has everyone understood this much? Yes or yes? समझ में आया या दिमाग के ऊपर से? हाँ जी, एवरीवन आगे आ जाओ. और क्या चल रहा है? ग्रेट. वेरी गुड. ठीक है. हाँ जी. ओके. AIMS May 2016 question. Can you please read this beautiful question, guys? That's how the question gonna come for exams. How much time later should ROP screening be done for a 2-week-old baby being treated in NICU for sepsis who was born at 28 weeks of life? Anji, anyone? What's the best answer? Someone is saying A and someone is saying B. अब मुझे तो कंफ्यूजन हो रही है। हाँ जी एवरीवन। ओके वेरी ब्यूटीफुल, सच अ ब्यूटीफुल आंसर। डॉक्टर कौन बोल रहे हैं? डॉक्टर साहिल, डॉक्टर साहिल सेज 4 weeks। ओके एनीवन? ओके संभव, संभव इज अ नाइस नेम। संभव सेज 4 weeks। ओके वेरी गुड वेरी गुड। समथिंग न्यू अपना आर्यन, आर्यन सेज 4 weeks। ओह बहुत बढ़िया। अच्छा अब मैंने 4 किया तो पूरी दुनिया, आकांक्षा अहमद सब चक्कर खा के 4 weeks कर रहे हैं, बट 4 weeks इज अ रॉन्ग आंसर, द फॉर रॉन्ग आंसर। ठीक है? Remember, क्यों सर, क्यों 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 नहीं, मुझे नहीं पता गलत कैसे हो गया। देखो क्या लिखा है, read the question again. The question is actually a baby who was born at 28 weeks of gestation. Okay, it's written who was born at 28 weeks of gestation. This baby is a 2 weeks old baby now. This baby is a 2 weeks old baby now. Means the baby was born 28, but right now this baby is 30 weeks old. Right now he's asking how much time later should ROP, कहाँ चला गया, हाउ मच टाइम लेटर, एक सेकेंड जाता है तो में आ रहा है। सो इट्स, मैं एक बार इसका वो हटा दूं। तो यही लिखा है ओके, दैट हाउ मच टाइम लेटर शुड ROP स्क्रीनिंग बी डन फॉर अ 2 weeks old baby who was born at 28 weeks. Baby was born at 28 weeks. Right now he is 2 weeks old, means he is 30 weeks. So how much time later you want to do the screening? After 2 weeks, after 2 weeks। okay, yes exactly। डॉक्टर साहिल से भारी मिस्टेक हो गया। भारी वजन के लोग भारी मिस्टेक ही करते हैं। ठीक है? या ओसामा क्या कह रहा है? साहिल भारी मिस्टेक, क्या क्या साफ ब्लंडर हो गया। एग्जैक्टली समझ में आ गया। ठीक है, सो 2 weeks इज द बेस्ट आंसर या यू शुड। ओके एंड व्हाट इज द नेम ऑफ दिस प्रोसीजर माय डियर फ्रेंड्स? ये कौन सा प्रोसीजर है? What is the name of this procedure, bro? Is this a direct ophthalmoscopy? Is this a slit lamp examination? Is this a indirect ophthalmoscopy? This is nothing but indirect ophthalmoscopic examination। मैं बता रहा हूँ, okay? रितु दिस इज इनडायरेक्ट, इट्स नॉट डायरेक्ट, इट इज इनडायरेक्ट। आर यू अंडरस्टैंडिंग? समझ में आ रहा है ना? इट इज नॉट इनडायरेक्ट। इन अ डायरेक्ट ophthalmoscopic examination I'm very close to the patient, I have the ophthalmoscope in my hand, I will check like रखूंगा, पेशेंट नजदीक आएगा मेरे, ऐसे देखूंगा। Can you please tell me how do we look for slit lamp examination, and can you tell me any one important disease where the investigation done through a slit lamp examination? Very very common question, very common question। हाँ जी, अपनी सुनहरी नोनी सी आवाज जरा थोड़ी तेज करिए और बताइए मुझे, कौन बताएगा? डॉक्टर शुभांगी, ओसामा, वन? वेरी गुड वेरी गुड। Yes, that's right. That's right. Very good. Okay. Hanji. Slit lamp examination. Number one, it is that examination. Remember, have you ever been to ophthalmologist? You remember you put your chin. There is a machine, right? You put your chin like that, and you put your that machine's metal should touch your forehead, and you should put your chin like this, and on the other side the ophthalmologist is sitting and he is looking at you, and then one eye you are focusing, then another eye he will put the machine, and another eye he will focus. That is known as slit lamp examination, and very very important in a case of Wilson disease, one of the important conditions where basically you see KF ring in the descent membrane of cornea, and that ring is appreciated through a slit lamp examination. That ring is appreciated in slit lamp examination. The investigation of choice, like in general, like to look for the KF ring in Wilson disease, slit lamp examination done. To look for ROP screening, indirect ophthalmoscope. Next question, please. Yeah. What is the blood volume in a preterm baby? Nice question. Decent question, 2013. Anji, very good, doctor. We have doctor, you are mine hearts. क्या नाम है? You are your mine. अच्छा तुम मेरे हो, your mine hearts. तुम मेरे दिल लो क्या? ATP7 भी, that's true actually. डॉक्टर सुमन says ring, KF ring. मुझे वो bronchiectasis की signet ring लग रही है जो तूने भेजी। Blood volume in a preterm neonate. The best answer for this question is ABCD. Metazillose says 80 ml. Anyone? Monimala also 80 ml. Dear 80 ml per kg, or I would say 60 to 80 ml per kg is the blood volume. 90 to 110 ml per kg, 90 to 110 ml per kg is the blood volume in a preterm baby. Will you remember this? These are very basic questions, and if it becomes a repeated question in exam, sometimes in some paper, they just copy paste the exam question like that. So don't do mistake. Okay, 60 to 80 ml per kg एक term बच्चे का blood volume होता है, और 90 to 110 ml per kg is a volume in a preterm. Okay, next question please. Over, yeah, very good. Recent question. Who will tell me recent question? Anyone? Yes, exactly. One second. Recent question. ABCD. Preterm neonatal target saturation is dash. ABCD. What do you think, bro? तक वीडियो आ रहा है, मेरे ख्याल से चल तो रहा है, आवाज आ रही है? हाँ ठीक है। क्या आंसर? व्हाट इज एबीसीडी? एबीसीडी, क्या? 91 to 95 ml per kg sounds a very decent answer. More than 95, no. 85 to 90, no. This is. Have you understanding, everyone? Please put a like button to this video. Yes or no? Okay, this part, very nice question. So preterm, also see preterm SpO2 91 to 95, or if I said 92 to 94 also, okay. See this baby, this, can we see that this baby is having 91, here it's written 91, chalega 91, 92 range all. See, hello everyone, the examiner will give you closest best answer. Don't say that exact 92, exact 94. No, it can have a range. 91 to 95 also is okay. 90 to 94 also is okay, right? But anything more than 95, like what is the take home message? More than 95 not allowed, less than 90 not allowed. Less than 90 is too less, more than 95 is too high. So 91 to 95, 92 to 94 sounds very good. Next question please. SpO2 of a newborn at second minute of life, कौन बताएगा? What is the SpO2 of a newborn at second minute of life? The best answer is dash. Anyone? Quick, very quick answer. Exactly. शुभम कहाँ पे है? हाँ, the SpO2 of a newborn at first minute of life is 60 to 65%. At second minute of life is 65 to 70%. Very good. Kavya is right. अपना Shubham is right. Osama is right. Suman is right. Perfect. See, guys are amazing. Shubham be very good. Very good. Next question. Again, we have a very quick motivating quote, and motivating quote says, "Be you, be you, because everybody else is already." Be you. हम है, बाकी पानी कम है. Be you. Don't copy him, don't copy her, don't copy them. Be you, be original, be crazy. Every one of us has some speciality, some spark, and just be amazing, okay? You just realize how amazingly beautiful you are. The time you start realizing it, you might as well as embrace it, appreciate it, feel good about it, okay? So that's what, be you, because everybody else is already. That finishes today's class. Has everyone understood this much? Yes or yes? और शुभम क्या किया शाम को? बातें करते हैं. Exactly. डॉक्टर मोनीमला सेज स्वामी हीरानंद कोट हीरो आनंद. ओके, शाम को टेस्ट दिया था तुमने? शाम को टेस्ट दिया था? करके आई हो, गुल खिला के आई हो? टेस्ट दिया ना तुमने? क्या, कितने गुल खिलाए? कितने क्वेश्चन सही हुए तुम्हारे? 35 क्वेश्चन थे. हाँ जी, कैन वी हैव दिस वन? 35 क्वेश्चन वर आस्क्ड, राइट? कितने, सबके कितने नंबर आए थे? हैं, सच बताना, मारूंगा नहीं. ओसामा, कितने नंबर आए तेरे? मैं तो लोगों का 1 to 10 में नाम ही नजर नहीं आया मेरे को. हाँ जी, please tell me how many marks you got in the evening test. The quiz was totally new, right? How are the questions? Okay, middle class, high class, good class, elite class, very easy, very tough, boring questions. Okay, Monimala says 10 out of 35, 10 were right. Okay. Dr. Sona Susan Binoy says, when are you taking erythroblastosis fetalis class? It's very easy. Once we do neonatal jaundice, वहाँ पे आएगा erythroblastosis. हाँ जी, डॉक्टर मोनीमला 10 आउट ऑफ 35. ओके. ओके, मोनीमला 10. शुभम 13. ओके, हाँ जी, शुभम के 13 आए. चमकेगी जब बिंदिया, चमकेगा इंडिया. अभी. ओके, नंबर बताओ बेटा, नंबर 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 कितने आए भाई? सर, स्टार्टिंग मी अ हैप्पी. ओके, नंबर कितने आए? हेलो नंबर, बातें तो होती रहेंगी, बातें तो होती रहेंगी। हाँ जी। ओसामा 12, क्यूट, वेरी वेरी क्लोज टू हाई रैंक, वेरी क्लोज। जिस 15-20 नंबर का ही तो फर्क है, ज्यादा फर्क कहाँ है ओसामा, 15-20 नंबर का फर्क ही तो है, क्या हो गया? ओके। काव्या से स्टार्टिंग में अच्छा था, एंड में गड़बड़ हो गई। ओके। मेटाजिल्लो से 14। ओके हाँ जी, एक बंदा और अपने नंबर बताए, कोई बेइज्जती नहीं होगी, नो प्रॉब्लम। पता ना आते नहीं है, पूछने का नहीं। ओके ओके, एनीवन? प्रिया, प्रिया गुप्ता 16। Such a beautiful rank we have. We all are a part of pediatrics by Dr. Anand, and 10 out of 35, 13, 12, 14, 16। और डॉक्टर विकास के कितने आए, कौन बताएगा? हमारा तुम्हारा भाई विकास, कितने नंबर आए उसके? 35 आउट ऑफ 35। शुभांगी के कितने आए? शुभांगी कौशिक, 35 आउट ऑफ 35। एंड जलपित, जलपित के कितने नंबर आए? 34 आउट ऑफ 5। है ना? है, बेइज्जती हो रही है, बेइज्जती महसूस हो रही है, तेरी बेइज्जती हो गई, बेइज्जती हो गई, होगी बेइज्जती, बेइज्जती हो गई। ओके ओके ग्रेट। Okay, ROP finished, that's it. Tonight we're going to talk about neonatal sepsis. Tonight 11 p.m. we have a very beautiful class on neonatal sepsis. Neonatal sepsis, quick 30 minutes, very quick talk we're going to have on neonatal sepsis. तो फिर ओके, तो शाम कैसी रही? हाउ वाज द इवनिंग एवरीवन? लेट्स टॉक फॉर 2 minutes, then we'll end up this class. How many of you, how many of you went to gym? Time right कर दी? Yes, this is the biceps. We are focusing now on good biceps. Started super set in my instructor is really proud of me. And what you guys did? ओके। अपूर्वा कह रहा है मोनी मोला की बेइज्जती होनी चाहिए, क्यों बेइज्जती? तुम्हारी बेइज्जती नहीं होनी चाहिए, सबकी एक एक करके बेइज्जती होनी चाहिए। ओके सॉन्ग, अच्छा कौन सा कोई भी सुना दो, कोई भी सुनाओ। मुझे शर्म आती है, बहुत शर्म आया। ओके, आज अच्छी नहीं गई शाम टेस्ट को लेके। चलो कोई बात नहीं, रिवाइज तो कर लेना ओसामा, रिवाइज कर लेंगे, हो जाएगा रिवाइजिंग। ओके, अब तो मैंने बहुत सारे नए क्वेश्चन बना लिए हैं, सब हो जाएगा। ओके ओके, अ वेरी क्विक सॉन्ग, अ वेरी क्विक सॉन्ग। मेरे पास ही रहना, जाना नहीं, ये दर्द है इतना, आना नहीं, डरते न थे मौत से, अब मगर डरने लगे, आवाज दो हम खो गए, नींद से जाग, कब सो गए, मर जाएंगे, मगर दूर तुमसे हो गए, आवाज दो हमको, हम खो गए। मुझे मुझे जिताने के लिए मेरा वोट है, मेरा कोड है डॉक्टर आनंद, मुझे आप वोट कर सकते हैं। और ऐसे हैं ये लाइंस रात को 10 बजे तक। थैंक यू, देखता, या एग्जैक्टली। तो we we have a person who is asking something. His ID is yes you. Yes you is asking a very important doubt. So the answer for that doubt, Mr. Yes you, is it is pediatrics by Dr. Anand. Once you type it pediatrics by Dr. Anand, you will find all the mysterious answers. So that line is pediatrics by Dr. Anand. Okay, ठीक गाया मैंने। ओके, कुछ ऐसा कर देखा खुद, क्या? कुछ ऐसा करके दिखा, खुद खुश हो जाए, खुद खुश हो जाए खुदा। अपूर्वा से सर रॉक्स इन सिंगिंग। मैं सीख रहा हूँ, ओसामा वांट्स मी टू लर्न इंग्लिश न्यू सॉन्ग्स, एंड आई एम सो बैड इन, फील सो बैड। आई विल लर्न। ओसामा हम सिंगिंग क्लासेस करेंगे बाद, ठीक है? चलो ठीक है। Dr. Manish, yeah, tomorrow, from tomorrow, the links will be there with you, right, on the Unacademy. We have a 5:15 p.m. class also tomorrow. So let's meet tonight at 11 p.m. Let's talk more about life and just chill. Okay. Thank you so much, everyone. Take care. Have a wonderful evening ahead, and may God give you everything. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है। नंबर वन, उसको वेस्ट नहीं करना। नंबर टू, ऑलवेज हैव दिस पॉलिसी, आओगे तो वेलकम, आओगे तो वेलकम, जाओगे तो भीड़ कम। ओके, दैट्स हाउ यू शुड लाइफ, एंड यू हैव नथिंग टू, so important, you have nothing to lose in life. Someone loves you, they will come to you, and if someone left, then they were never meant for you. It is as simple as that. Okay, so don't have this energy that I want a best friend, no one should leave, I feel so lonely. Don't have this bad habit. Still say, I am happy, people want to come in my life, welcome. If you want to go in from my life, we'd come. If you really love me, we'll stick to what. Okay, people who love me, they message me anyhow, somehow, somewhere, they message and they are in touch frankly, and so it's natural process, right? So please have your value, and most importantly, don't become greedy. Okay, don't become bad, don't become greedy, don't have attitude issues, don't have that. Be humble, be humble, we all have a past. Okay, be humble, we all have a past. Other person is also having a past, I also had a past. Okay, so be humble, all have a past, but be self-worthy also. Need to know your, you're very right. Tell yourself you are a very good soul. Tell yourself you are a perfect soul. Tell yourself you are a very peaceful. Tell yourself you have everything what is required. Oh, very beautiful. Are you dependent on anyone else? Are you dependent on someone to be loved or get loved? No. Are you dependent on any materialistic things or any man, woman, person? No. Are you happy with yourself? Are you content with your life? Are you okay with your own company? Yes, I love my company. I appreciate that. Thank you so much, everyone, for this one participation. See you tonight at 7. Till then, bye.